Okay, so I'm with Barry Stein, President and CEO of Colorectal Cancer Canada. Hi, Barry. Thanks for joining me.
Great to be with you.
It's always a pleasure to talk to you, and this is a really important new campaign that CCC is rolling out. So just tell me, first of all, what this campaign is to lower the age from 50 for routine screening for CRC down to 45.
Right. I think it's really important first to understand what screening is. So, screening means that you just turn a certain age and then you get tested to see whether or not you are positive for colorectal cancer or might be positive. And we use a simple stool-based test, which you do at home. And if positive, then you would go on for a colonoscopy to determine exactly what the situation is. Because what we're doing is we're looking for hidden blood in the stool, which may be an indication of colon cancer. So today
Mhm.
in Canada, we do screening throughout the country through a programmatic approach where a letter or an invitation is sent to individuals starting at the age of 50 to 74 years old. And in Quebec, we do it opportunistically. In other words, you do it on your own if you would like to do it, and you do not at this
Mhm.
point get a letter from the government, inviting you to join into the program. That said, we all do screening in the territories as well, starting at 50 years old to 70 years old with a simple test called the fecal immunochemical test. So, when we do screening, we do it for a reason, this way, because we don't want to do any harm to people by just giving everybody a colonoscopy, for example, or doing any invasive tests. So you have the option
Mhm.
to start with this stool-based test, as I said. And what we need to do is to get a large amount of that target population, in other words, 60% at least, to participate so that we can lower the incidence and mortality from the cancer. In other words, we want to find either a polyp and prevent you from getting colon cancer, or find it in its very early stage when we can cure that cancer quite
Mhm.
easily. Because once
Mhm.
a cancer goes from one organ to the next, it becomes much more difficult to do.
Right.
So,
Late stage. What
yeah.
is the participation rate right now for screening after 50? What are we averaging?
So right now, depending on how you look at it, just from the FIT test, we're probably averaging around 40% in every province. If you add in those who also get screened by colonoscopy because they're at more of an elevated risk because they have a first degree relative, for example, that had colon cancer or rectal cancer, or they have something like a Lynch syndrome, those are people at elevated risk, and they would start with a colonoscopy in those particular cases. And if you have a relative, a direct relative, a parent, for example, who had colon or rectal cancer at 50 years or younger, then you would start testing 10 years earlier because a polyp takes
Mhm.
between 8 to 10 years to grow from a polyp into what could be a cancer and then spread.
Mhm.
So what are we doing? We're saying we're starting at 50, but can we get more people screened earlier? Because we know there is this fast-growing movement of young individuals who are being diagnosed with colorectal cancer, and particularly actually between the ages of 28 and 39 years old with rectal cancer, and for an unknown reason. We don't really know why
Mhm.
this is happening. So we're studying in the microbiome, and we do think that there are some relations between diet and exercise and so forth that may be contributing factors to this. But we do know that if we start screening at 45 years old as opposed to 50, we can capture in that population, quite a few cancers, or even prevent those cancers from happening. And not only does some of the simulations show that we could save in the next 40 years over 5,300 lives, but we can also save money to the healthcare system, about $517 million by estimates to the healthcare systems, because we don't have to treat these cancers with very expensive drugs and have the hospital and care costs and so forth. So by lowering the
Mhm.
screening age from 50 to 45, we not only can save lives, but we can save money in doing it.
Mhm. So why haven't we done this before?
Right. So the million-dollar question. So in the US in 2018, they did lower the screening age to 45. And in Australia last year, they also have a similar healthcare system to ours and a similar population and economics similar to Canada. So they lowered it there. We haven't done it here because, principally because of capacity issues, and the ability to do colonoscopies for the positive fits which are anticipated. What we,
Mm-hmm.
we found in the US though is when they lowered the screening age to 45 from 50, that only about 19% of the people between 45 and 50 actually participated in it. So it's not exactly like a gate crashing thing where people are going to rush to be screened, although we wish that they do
Mm-hmm.
ultimately. But from a capacity point of view, I don't believe that we're going to have this huge uptake where we'll have the 60% of those from 45 to 50 who will be actually getting screened. We do think
Mm-hmm.
that it's important that people become aware of the signs and symptoms of the disease at an early stage and how to reduce the risk of colon cancer through healthy lifestyles and to get screened starting at 45. That said, these are just numbers, 45 or 50, which health economists look at from a cost effectiveness basis and from the clinical basis as to when it makes most sense to start doing screening of a whole population for doing that. So you may be a 40-year-old or you may be a 80-year-old and in need of a fit test. Well, in Australia, you can within the government system, outside the program, but within the government system, request that you get a fit test at 40 years old to 45 years old, and from 74 years old to 85 years old. So we think that ultimately that's another opportunity. Some insurance companies, in fact, will pay for that even today in Canada, and that's not all that well known. So it's a message that we want
Mm-hmm.
to get out there as well. But from a programmatic approach in each province and territory in Canada, and as well for our federal government, for the Indigenous populations and the armed services, we would like to see that screening age for the programs be reduced to 45. We believe we can save lives and we can save money.
Mm-hmm. What's it going to take to make that happen, Barry?
It's going to take a lot of advocacy. So we started, first of all, by looking at the evidence and working with the epidemiologists and physicians across the country and our watching group in terms of the National Colorectal Cancer Screening Network to see what the best evidence is out there. And we believe both in Canada and elsewhere, the US and Australia, that the evidence has demonstrated that this is something that would be cost effective and very important in terms of saving lives. And in Canada, it's going to require some advocacy to do that because there's a question of the funding availability. There's a question of training more people to do colonoscopies, investing in equipment and in endoscopy clinics or suites. So this investment has to be made, and we have to be a little bit more visionary. It should have been made before. Some of the work that we do is envisioning so that we can advise or advocate for changes in Canada to help adapt some of the new technologies and so forth. And I think that will help us as well. So, is there a role for our artificial intelligence to play both in selection of people and to help with the colonoscopies, which is already being implemented in colonoscopies to better identify where a polyp might be when it may not be so obvious. How else can we use artificial intelligence to better select those who need to be screened first? But overall,
Mm-hmm.
we want to capture that population at least starting at 45 years old because the evidence is in, and we believe that we can make a difference in Canada by making these changes.
What can Canadians do to get on board with this campaign?
So the first thing that we've done right now is we've issued our press release and we've done some of our publicity on social media. So the most important thing you can do right now is to keep help spreading the word from our social media and from many media that you see about early onset of colorectal cancer and the need to get screened earlier. And that's kind of an easy thing. The first thing, just go on social media to colorectalcancercanada.com. You'll see the information there on our Screen 45 campaign or on our social media at colon Canada. That's COLON Canada, and you can help spread the message. The second area where you could help is through advocacy at the appropriate time. So right now we're working with organizations such as the Canadian Association of Gastroenterology and other organizations like that who agree that the screening age should be reduced and have looked at the evidence and made decisions based on that evidence. Our next level is we have written to every minister of health in the country and we'll be having meetings with them. Actually, one of our first ones will be with the ministry, not the minister himself, in Alberta, as it happens, where you're situated, Jocelyn.
Mm-hmm.
And we'll do that province by province and territory by territory. And then, if we don't see any changes still happening, we'll be working with other organizations of like mind to put further pressure on, and ultimately through the public at large, if need be. But right now, from an individual point of view, help spread the message, help spread awareness about colorectal cancer in general. We don't want to forget about everybody else 50 and over as well. But we do want to see that younger people are aware of the signs, the symptoms, and how to reduce their risk from colon cancer.
Mm-hmm. What's your timeline? If you're on your wish list, when would this be implemented?
Yesterday
Yeah.
would be my timeline. But
Yeah.
realistically, we've already done our outreach to the ministers. We hope in the early fall we'll start having, those meetings, or at the end of the summer, start having some of those meetings and get some results. And what we hope to see is either, more organizations join in the call for the reduction of the screening age until some of the provinces decide that this is a priority for them as well and start doing the work to implement a change of that sort. It's not
Mm-hmm.
realistic to think that we're just going to flip a switch and everybody's just going to switch the screening age to 45. The bureaucracy, if you will, the infrastructure has to be prepared to accommodate these changes, increase capacity in some cases. But I
Mm-hmm.
think it's doable. We heard those same discussions and arguments when we talked about implementing screening programs in the first place, right? Every time we don't have the
Yes.
capacity, we don't have the money. Well, when we make that call and those guidelines start to change, we want to see the investment as well being made to increase the access to colonoscopy. Using
Yeah.
the increasing the fit test is really not that big a deal because the
Yeah.
equipment can handle that increase in capacity in the labs. Getting people to do it, encouraging people to do it is another story too. So we'll need it on that end, both in terms of awareness, not only of the disease, but how to prevent it and screening and what that means, but also in terms of who should get screened and when.
Mm-hmm. Well, CRC rearing its ugly head under the age of 45 more and more frequently every day. And those Canadians, 45 to 50, they deserve as good a shot as anyone. So I wish you all the
Absolutely.
best with the campaign. And let's hope we can make this happen. Thank you so much, Barry.
Thanks so much, Jocelyn.